Yeah, start. Okay.
Good evening. The Kerala State Mediation and Conciliation Centre is the governing body as far as mediation in the state of Kerala is concerned. As part of the continuing learning program, KSMCC has decided to organize a few programs. We are about to inaugurate the program by Honorable the Chief Justice, Dr. Justice Manjula Chellu, the Chief Justice of High Court of Kerala, and also the Chief Patron of Kerala State Mediation and Conciliation Centre. We have with us Mrs. Loney Jacob, a clinical psychologist, and also Advocate Sreelal, Warriar, a mediator attached to the Ernakulam Mediation Centre. The topic for the day is psychology, its relevance in conflict management. May I now invite the Honorable Chief Justice to inaugurate the program.
Good evening to all of you, and it's a new venture on the part of Kerala Mediation Centre, having lecture series on by way of video conference. I am very glad that the topic chosen today is psychology and its relevance in conflict management. Expert is with us, and she must have seen the different kinds of behavioral patterns which really forms basis for the conflict. The mediation philosophy is based on making the parties to identify their problems, especially with reference to the emotional feelings of them, where, why, and how their personal feelings towards the opposite party is coming in the way of some settlement. The duty of the mediators is to identify that and kindle that sensitive feeling in them, which can make them realize and make one step down or take one step forward in the process of mediation and then come to some settlement. Conflict management definitely needs understanding that part of the psychology of the parties who are before us, so that the mediation process can be made very, very easy. And unless the mediators have some inputs into this, because it is also like any other subject, people have to study and learn the subject. So we have the expert. Some people get it by, it's a gift. People can understand others' feelings very well. And some people need a bit of training to understand others. And being lawyers, it is very easy for advocates to adopt these tips to be given by our expert who is with us today. And I'm sure the lecture or the tips that she is going to give us in managing the conflicts before the mediation center will have a long way to go and will be of great use for the mediators. We thank you very much on behalf of the center. I'm sure this is going to be a lot beneficial and useful exercise for all the mediators. Thank you very much.
Very good evening and warm welcome to the first of the multi-session learning program that the KMC has initiated.
I'll be happy to.
We have with us today Ms. Loney. Ms. Loney Jacob is a clinical psychologist who has put in about 28 years of practice. She is a gold medalist from the Delhi University in her subject and has higher education in US. Ma'am, it's certainly a privilege that we have you here, not only because you're a clinical psychologist, you're also a trained mediator.
Yes.
And you would be certainly the best person to have been a resource person here.
Thank you.
The topic that we have chosen, especially expecting you here, is the human psychology and its relevance in conflict management. And for any person who gets into conflict, or a person who is involved in managing conflicts, it would certainly be advantageous if we get to know a little about the psychology and its scope.
Yes, actually, psychology is very relevant, and understanding human psychology and everything it deals with would definitely go a long way in understanding how to handle conflicts. Human psychology is basically a scientific study of human behavior, to put it very simply. But it goes beyond observable behavior. It studies deeper psychological processes like our attitudes, our feelings, our belief systems, our value systems, and so on, what we call human psychodynamics, which help us understand how our behavior is influenced by these, how they impact human behavior.
We generally find a lot of people who get into the conflicts.
Mm-hmm.
It would be nice, if you can understand as to why individuals get into conflict situation and what level they get into conflicting situations.
Okay. Actually, we see conflicts everywhere. People disagree, largely because we are, very specific individuals, with our own traits and our own, personality makeup. So two people could agree on a single point, and they could disagree because they have their own ways of looking at it. We perceive the same thing in a different way because of our individual characteristics. So, disagreement is part of life. How we deal with it is what is important.
Are there different levels at which, with respect to the same thing, are there different levels at which one could be, getting into conflicting situations, or different levels at which he could be contributing to the conflicting situation?
Yeah, that's very interesting because, we've done, there's so much of work being done in this field regarding conflict management. But to look at it very simply, we can actually zero in on, say, 4 basic factors, to put it very objectively. Why do we disagree? It could be two persons having a problem and they want to solve it. They could disagree on, say, their objective. What is their focus? What is the objective of the problem? And or on the other hand, they could agree on the objective and disagree on the method. What course of action should they take? For instance, say 2 brothers who want division of property, the objective, could be, equal share. Okay, they could agree on their objective, but the method they could disagree. Whether they have alternatives, like you take a legal, you take the legal help, or you can, maybe talk among elders in your family. Whatever method you want to use to solve your problem. Okay, but we see that even though there is an objective and a method which you would agree on, things still go wrong. And that could be because maybe poor communication. Lack of good communication skill leads to a lot of, misunderstanding. And that could lead to a lot of, conflicts, and, bad blood, disagreements, confrontation. It can go on to different degrees. But we realize that, we could agree sometimes on the objective, we can agree on the method, we can also have good communication skill and agree on what we have agreed, and yet we could continue to disagree. Okay, and a lot of it, why do we disagree, even in spite of agreeing on all the major points? This could be because of emotional factors. And a lot of time we find people disagreeing because of underlying emotional issues that happen at a very unconscious level. They themselves may not be aware of it. And these emotional factors could be, say, anger, could be, say, fear of losing face, or could be embarrassment or peer pressure, or sometimes as simple as not willing or maybe steadfast commitment to a prior position. They don't want to change. Okay. So, emotions could play a very vital role at a very unconscious level, to create disagreements or conflicts between people. Yes.
Emotions, is it right that it could be induced soul so that it is inherent in persons, in fact? Otherwise, an emotionally strong person, otherwise an emotionally weak person. Mm-hmm. So also a third person inducing an emotion while they're dealing with some kind of a conflict.
Yes, actually that is really very interesting because, we study a lot about emotions, and yet, the knowledge actually helps us to develop, strategies as to how the brain works, how the human being, how the individual reacts, and, what do we do to maybe bring it under control? Isn't that what you're asking me?
But what I was meaning was, I am otherwise a very strong person. Mm-hmm. I'm not a weak person. Mm-hmm. But can an emotional imbalance can be created, induced by a third person while I'm dealing with that particular person?
Let me tell you something very interesting here. You see, human beings are very, interconnected, porous beings. We actually, there's a lot of information that is going across from person to person at a very unconscious level, very automatically and very fast. Okay, and this actually you would notice maybe, sometimes we feel what the other person is feeling, even if the other person, you don't know the other person. You feel similar emotions. And why is this happening? The very interesting part is, there's something that's happening in our brain. And what we call mirror neurons, there's something called mirror neurons that is there in the brain, which actually imitates what's happening in the environment and tries to mimic it. So, when we see someone else's facial and body expressions, the mirror neurons fire. And the brain tries to relate to these expressions. So that would actually explain why, we feel empathy maybe towards another person with whom we are not actually interacting with. Or maybe why it is very difficult to maintain your confrontational stance when the other person is being nice to you. So you see, what is so interesting here is what we say is go soft on the people, because that is when you use a constructive emotion like empathy instead of a destructive emotion like anger to set the emotional tone of the environment. You see, so you have a lot of control here, Instead of falling prey to a dominating emotion, you can set up the emotional tone of your environment to, facilitate a process to go forward. Yes.
Somebody who is otherwise involved in managing conflicts, I believe this is some kind of a training that the person should be having, I believe, in fact.
Yes.
So that he can control, exploit this kind of a phenomena to bring the other person down.
Yes.
In fact. Now, what happens, as part of psychology, what happens when somebody gets emotionally upset?
That is...
in relation to the conflicts he is supposed to be managing at that stage.
Yeah, that's amazing actually what happens to the human body. There's one thing that happens to us physically, and there's something that is going on independently in the brain.
Fine.
Let me just, explain a little bit more if it's okay. We all say we have one brain, but I would like to say that we have three brains. You see, we have something called the rational brain, which we all feel maybe we all have a lot of. Okay, everybody likes to believe we are rational human beings, but equally important is the emotional brain. Okay, and inputs from the emotional brain actually help us make better decisions. Okay. And the third brain is the lizard brain. Okay. Lizard brain is actually what our species is brought with our primal instinctive, responses, not really controlled by, other experiences that we have, which doesn't really work very often, but works under, extreme cases like stressful situations, which I'll just come to now. Now, under normal circumstances, the brain functions normally and the communication between the three brains goes on very smoothly. Okay, I would like to mention here that the rational brain is actually taken care of by the neocortex, that takes care of the functioning of the rational brain. Okay? The amygdala, that is at the base of our brain actually takes charge of the emotional content. And it is the amygdala that again controls the smooth flow of information between the three brains. Okay, so what happens in a stressful situation? Before I get into that, let me just explain how these three brains work. Okay, to make a smart decision. Okay, suppose you have a decision to make. Which brand of shampoo should I buy? If we use only the rational brain, we would actually take a long time, because the brain would check out each brand, weigh the advantages and disadvantages, and then discard a brand and go on from one to the other. And this is a very tedious, long process. But the emotional brain gives inputs in a very unique way, because it has its database of emotional experiences. Okay, so when information comes in from there, we get information like, okay, this shampoo feels good. Okay, this smells good, or my hair feels good. So, this information, actually united with the rational information helps us make a quicker, smarter, more optimum decisions. Okay. So, under normal circumstances, the amygdala helps flow of information. But what actually happens when we are stressed out? Okay, and this happens, say, during conflicting situations. People are stressed. People are angry, or people are upset, and what happens is the amygdala gets locked. And when the amygdala gets locked, there is no flow of information between the three brains. The information enters into our brain and goes straight to the emotional brain, but there is no input from the rational brain. So you see, we are flooded by emotions, and this is what we call emotional hijacking. And since there is no rational input, decision making is taken over by the emotional brain without the rational brain putting it. Yeah. So during this locked phase, the emotional brain takes charge, and we call this emotional flooding or emotional hijacking, and not a very good time to make good decisions. Yes, but same thing. Something happens at two other levels again. Something happens at the physical level. And what happens to the human person, the individual at that time? He's stressed out. His blood pressure could go up, muscles could stiffen, he could have palpitations, he may be sweating. These are all physical symptoms of stress. And when he is in such a situation, and how would he react to a situation like that? Going down to the third level, the response is again now taken over by the lizard brain, because the lizard brain thinks only of, there's danger in front of me, how do I survive? Okay, so we call this the flight or fight syndrome. In other words, connecting it to conflicts, if we react by running away, the flight part, we could avoid the conflict. And if we react by fighting, we are confronting. We take a confrontational attitude. So both are survival mechanisms. It's like walking down the road, seeing a snake in front of you. What do? The lizard brain takes charge. You have all the physical symptoms of stress, but you need to survive. What do? Either I run or I take a stick and hit the snake. Okay. So this is what happens in a stressful situation, also in a conflict situation. Okay. So this is what happens again to the body, and how we react to the response. Okay. But something very unique is happening in the brain, and that is what actually gives us much more information as to how do we deal with a situation like that. What actually happens is there is a hormone called cortisol that is released into the brain. Okay, and when this is released, it happens very fast, automatically. We are not consciously aware of it, and that is when all the physical symptoms start. Our muscles stiffen up, our palpitations, or heart beats faster, and so on, which I had just mentioned now. And when this happens, the amygdala gets locked. So good decision making is not the right time. Okay, and it just takes 33 milliseconds to reach this
33
point.
milliseconds.
Yes, 33 milliseconds for the cortisol to get released, amygdala to get blocked, and no good
The
decision
standstill
making.
situation.
Yes, yes, that's true.
But somebody, is there going to be a situation for long, or is
Yeah.
it something which is manageable
Okay.
otherwise?
Yeah, definitely. That is what we have good information coming in from neuroscientists and psychologists who's been working in this area. And even the neuroimaging studies have shown that, you need a recovery time.
Okay.
And for the recovery time for cortisol is about plus minus 20 minutes.
Okay.
Okay. So around that time,
Right.
you need, maybe take a break. That is what I do
Okay.
when I have clients and we have therapy going on and there is a fight, there is argument, lot of emotions. Take a break, and it could help in calming the situation down. The amygdala will get unlocked in about 20 minutes, and then you could have maybe more rational inputs.
Fine. You said it takes about, we understand, certain things like this, that we also sometimes ask these people to go take a change and then come back and sit. Probably we get an explanation as to why we take this. It's probably this 20-minute syndrome that we have.
Yes.
Now, this is about managing, the natural way of managing the enzyme or whatever, getting settled. Is there any management technique whereby you can reduce the time from 20 to a shorter time?
I just talked about mirror neurons. You can control a situation. It could be difficult because the chemical environment is slightly different now.
Okay.
So we need the chemical environment to settle down. But at the same time, we talked about mirroring.
Mirroring is
Mirror
one
neurons,
technique,
that
yes,
could
yes.
help us.
Exploit the mirroring situation.
Yes, and also, what we speak, what we, our facial expressions,
Yes.
The right words that we use,
So on the communication aspect.
Yes.
The third part of it.
Yes. It could help after a short period of time for the person to recover. It could help, yes.
Even on the first four that you mentioned, on the goal setting and the methodology and the third one as to the communication, I understand somebody would like to help them out. Certainly can help them out with these kind of settings. In fact, you can help them set the goal. You can help them also understand the different optional modalities that we have.
Yes.
And the third one as to how better we could communicate on their behalf or passing on information.
Yes.
But when it comes to the fourth one, we understand it is a little too technical for us.
Okay.
That's on the emotional aspect.
Yes.
And suppose we identify this as something to do with emotional. Would you suggest that it is better that an expert handles it, and rather an ordinary man doesn't try it himself or on somebody else to manage the situation, emotional situation, condition?
Yes. Even I believe it would help going to a professional, because you really need to understand. Without making judgments, you need to understand this. Most of it are normal processes.
Fine.
It doesn't make a person not normal for having these emotions.
Fine.
So to deal with it, you really need to understand these psychodynamics.
Psychodynamics.
And a professional would be definitely more well equipped to deal with it.
To handle the situation,
Yes.
bring him back
Yes.
and
Exactly.
And on the emotions, there are times which have, when we feel, it has to be managed in a very, very professional manner, including by medication and other things, I believe. That. And certain others are probably by these kind of simple techniques.
Yes.
Now, when it comes to medication and management of these emotions, what is the normal pattern that you would suggest?
Okay. Actually, you would need...
Not for a self-help, not
No.
for somebody to be helping other if he is not trained. What is the the normal condition that you would...
it's always nice to go to a professional for a full evaluation to get done, because it's better it's not good to actually dabble with diagnosis, because as professionals, being psychological issues, we ourselves take time to find out, because it's not easy to evaluate an individual. Sometimes, it would look abnormal, but we don't use that term anymore, but not normal, and yet, it couldn't be a disorder. Sometimes it could be, and sometimes medication could help, sometimes therapy would help, sometimes a combination helps. So to make that judgment, you need a professional to understand.
And if it is something which has to be managed, if the person has to be managed first, it is always better that a professional manages the person, and then we get into the conflict management, I believe.
Yes,
the second part
help.
of it.
That would definitely help.
Ma'am, it has been very, very beneficial for us. We have gathered a few things, especially the fundamentals of which we had not known, probably most of us would not have understood. We understand especially the mirror neuron concept, and we get a lot of explanation, and the four concepts as to, the last coming in as emotions, exploiting all these things, and how the brain works, all that, certainly, is going to be helping for all those persons who otherwise face a conflict. So also those people, who help other people to manage their conflicts. And thank you, and it has been a wonderful time. And we look forward to the second session on the same topic, in fact. We will be having an advanced session on managing conflicts, these kind of, emotional conflicts that we have. Thank you very much.
Thank you.
Thank you.